Hey everybody, welcome to another Facial Friday. It's Lauren here, esthetician at Qatar Medical Spa. Today we're going to be discussing PRF. So what is this PRF? So PRF is a platelet-rich fibrant. So if you notice, it sounds really similar to what we call PRP, which is platelet-rich plasma. So you probably are wondering, what are they, how are they different, right? So the PRF is PRP's, let's call it its more advanced sibling, okay? So what you're gonna do is you're still gonna draw it the same way. We have to draw the blood in order to separate out the plasma, and we have to centrifuge it to get that separation. So this is where the process starts to become a little bit different. So with your PRP, it is centrifuged at a higher speed for a longer period of time, and you're gonna get a clear separation of that demarcation line separating the plasma and the red blood cells, the white blood cells, all this stuff gets separated out. Those fibrants, everything is going to be on the lower portion, those heavier particles. And so we're then going to extract out the plasma, which is the lighter portion of that mixture, which we can take out and then use in treatments. PRF is going to be a little bit different because it's actually centrifuged at a slower speed, okay, for a shorter period of time. And what you're going to do is not going to be that clear cut like demarcation of those two levels in the tube. So what you're going to have is, because of the way that it's centrifuged, you're going to have some more ingredients in that top portion that we're going to be using in the treatment. So that top portion now not only contains that platelets and plasma, it now still has some of the stem cells, the white blood cells, those kinds of ingredients that are now going to be utilized in the treatment. We haven't removed all of that. It still has the fibrin, so the growth factors, all of those things are still going to be in the serum that we're going to now be utilizing. Now, another way that they differ is because the tubes that they're drawn in and centrifuged in, the PRP actually has an additive in that tube, and that additive also acts as an anticoagulant, so you have a longer period of time that you can work with the serum, of course, because of that. Whereas with the PRF, it has no additives at all whatsoever in the tube, so that also means that it's going to coagulate a lot faster. So we have about 15 minutes from the time that we draw the blood and also do the treatment before that blood starts to congeal. So it's a much faster treatment time once it actually starts. So the preparation is done a little bit different because you have to get a lot of the steps done ahead of time before actually doing the blood draw and the treatment with the PRF because of that. But we start to go into some other differences, and you're going to start to see as we discuss the differences, like how the PRF can be of a greater benefit to what you're trying to treat. So one of the things that we're going to do is utilize these the PRF to get certain results that you're looking for. So you might be asking, like, okay, what are these conditions that we're going to be treating? So if you have concerns such as anti-aging, so your lines and your wrinkles, if you have concerns like acne scars, you used to have acne and now you still have some of those like divots in the skin from where the acne was, and you still have that scarring left behind. Also, your skin tone and texture may be an issue for you, or if you have, say, dark circles under the eyes or puffiness around the eyes, those are things that we're going to be able to treat with the PRF. So how we're going to do this is we have two different ways that we can utilize this ingredient. So one of the ways we can use is what's called microneedling. And of course, with that, what you're going to do is you're going to use, we use a microneedling pen, and it has about 12 little fine needles. And what that's going to do is give you microchannels like in the skin to allow this PRF to penetrate down into the skin. Now, of course, before we do this, one of the preparation that we're going to do is actually apply a topical anesthetic, of course, so that you can be as comfortable as possible while getting this treatment done. But what we're going to do is we're going to create those microchannels and then apply throughout that treatment. We're going to apply that PRF. So now that PRF is now going to be able to penetrate deep down into the skin. And what we're going to do is when that PRF gets down into the skin, it is now going to have all of those things that we talked about, the growth factors, the stem cells, all of those healing properties that it has, and it's coming from you. So it's your own healing properties, your own growth factors that are now going to be inducing your own collagen growth. So now this is going to, because of that, is going to be longer, the results are going to be longer lasting, right? Which is the key. The key is to treat what the condition that we're looking at and get the most benefits out of it, but then have that result be long lasting. Okay. And so what we're doing, we're actually doing the actual microchanneling in and of itself. That's going to induce some benefits. So that's going to induce that collagen growth and the growth factors like in your body, because you're going to create that little intentional injury to the skin to tell the skin to, hey, create this collagen because we need to start some healing. But now what we're doing is we're boosting that with that PRF, and that PRF is going to get in there, and now the cells have what they need to actually do that function at a faster rate, and also do it more efficiently and more effectively. And so this goes into another difference into the PRP and the PRF. So the PRP, those ingredients, the results will be long lasting, but those ingredients are really only working in the skin for a few hours after that treatment is done. Whereas with your PRF, you're gonna get about a week of that stuff like working in your skin, right? So the longer your skin and your cells has to use those ingredients to do the function that we want it to do, the better. So that's why we call the PRPs like more advanced cousin, because they're kind of doing the same work, they're kind of doing the same job, but the PRF just does it a little bit more efficiently and a little bit more effectively and for a longer period of time. And how this works is your microneedling sessions, depending on what you're treating, is going to take anywhere from 3 to 6 treatments. It just kind of depends. You'll speak to your technician to determine, what that is going to look like for you and your specific concerns. But for the microneedling, you're mostly going to be addressing, like I said, like your finer lines, your acne scarring, the skin texture and tone, and things like that. But now say your concern are some of those other ones that I mentioned, say like the really deep lines and wrinkles, or say like the bags under the eyes, the discoloration underneath the eyes. So now you're gonna wanna look at your injectables. So we can actually use the PRF as an injectable. And so now, especially for those of you who are concerned with some of the toxins or things like that we use, even though those are like safe for the body, some people still have some concerns about using that. So now you have a perfectly natural way of getting injectables. So what they do is they still do it in the same way. So think of it as an injectable or Botox, but instead of using those particular products for that, you'll be using your own PRF, your own growth factors to do the filling. And so with either of these, the results, you're gonna go anywhere from about, your maintenance period is gonna look like you're gonna get the treatment done for like that series that you discussed with your technician, and then do a maintenance like after that. But the way that they last is you're gonna get about, say like with your microneedling, you get say it's 2 or 3 treatments for you. That's going to last you after you get your package done. You're now going to go into a maintenance schedule of maybe now only getting the microneedling done 1 treatment once a year. So you see how this goes. So you're going to get your treatment. You'll do, a few of them like every month. But then after that, you're then just going to move on to a maintenance schedule. When it comes to like microneedling and like the injectables with the PRF, some of the difference too can be you're going to get those results faster with the PRF. So an example would be, say, with microneedling, you're going to maybe need, like I said, that anywhere between 3 to 6 treatments for the PRP. Whereas with the PRF, you may only need somewhere between 2 and 4. So, it's like you get those results a lot quicker with that PRF than with the PRP. So that's something else to consider when you're making that decision of the appointment that you want to make. One of the other things to consider is that when you're using it as an injectable, so with the fillers, you're literally only filling those spaces that you're looking at, right? The lines, around the eyes, the labia folds around like the mouth, things like that. Whereas you're just getting literally the filling. Well, now when you're using your PRF, you're getting additional benefits because now you're getting those healing properties that come with that. So you get the instant filling, but now you get those long-term results from having those growth factors and stem cells injected into those areas. So you get those additional benefits. And it's, of course, it's a lot more cost effective with the, with the injectables, because say you get about, say, like 4 tubes of the PRF, and that's going to equate to about only 1 tube of like the Juvederm. So like those are some great benefits, guys, to getting the looking into getting the PRF done. And so what we're going to kind of talk about is, well, one of the things I do want to mention is that when you're scheduling these appointments, you do want to, of course, keep in mind things like your schedule. So like, are you going to be out, and when it comes to microneedling, are you going to be out in the sun? Are you going to be out at the pool? Things like that. So you'll discuss that with your provider, your technician, and they'll talk to you about the best way to get that scheduled, because there are going to be a few days, immediately following your treatment that you're not going to want to do, those kinds of activities. And so they can discuss with you, your specific situation and what you're going to be doing, so that you can get them scheduled the way that it, is best for you, to make sure that you're getting the best out of your treatment, right? So we don't want to waste all of that investment that we just did, or cause any issues with that. Now, one of the other things that's going to play a factor into the results that you have, of course, is going to be your home regimen. So whatever home regimen you discuss with your technician, that's going to work best for you to prolong your results and to get the longevity out of your treatment, you're going to want to follow that, because that's going to be the best for you, and getting so that you can just go into that maintenance schedule now of doing like your facial services or whatever, like once a month, and then just doing like your microneedling, which is the more advanced treatment, like once a year. And so you're going to get the best out of that when you're actually following your home regimen, whatever that is for, whatever that is for you. Your home regimen is going to be the protection of that investment that you place in those more advanced treatments. So you're going to definitely want to follow that. So you have to think about it as 20% of your, whatever it is that you're trying to treat is going to come from the actual treatment itself that you're getting done. And then that other 80% is going to be what you're doing at home, right? To maintain it and keep it going, right? So you're going to want to make sure that you're following along whatever it is that your technician, or if your nurse, if you're getting the injectable version, you want to make sure that you're following that and keeping them up to date about any kind of changes that might be taking place. We are now going to kind of go into, I want to kind of show you a little bit about what, what this looks like. So we're going to switch over and kind of just go over a few of the like pictures, and maybe like a little short like video of like what the technique actually looks like when you're, say, doing like the microneedling, what the setup kind of looks like for the PRFs, so you can get an idea of what that process is like. And then we'll, of course, show a couple of before and afters. I have a before and after of using it as a filler, and then also a before and after of seeing the results after doing the microneedling. So I'm just gonna flip over. We're gonna kind of take a look at those pictures, and I'll kind of talk you through like what it is that you're looking at, okay? So guys, this is a setup that we'll use for the blood draw. Going from left to right, you'll see the alcohol pad, the tourniquet, then you'll see that vacutainer, which is like the butterfly, the needle that we use, and then the last thing to the right, you'll see those tubes that get filled, and then of course we have some gauze and band-aids for once we finished. This is just to show you what those tubes look like. So you'll notice the one on the left has that additive and the one on the right does not. So the one on the right is for the PRF. Here you'll see 2 centrifuges. The one on the right is for that PRP. The one on the left is a lot smaller. That's going to be for that PRF. And here we just want to show that difference in the 2 blood draws. So on the left, you'll notice with the PRP, there's a lot of cells in the bottom. So you have that demarcation of the 2 levels. Whereas on the right, you have a little bit more of those cells. A lot of those cells are now still at the top. So that's those stem cells, growth factors, and those great things that we want with the fibrins. And here we just want to show you a little bit what the treatment with the microneedling looks like. So that's that pin that we use, and we're creating those micro channels in the skin, and that's what's going to allow that PRF to penetrate. And here we just wanted to show you immediately after the treatment, there's just a little bit of pinkness. You'll notice on the right is the after, so it looks like a slight sunburn. So this is a great before and after of a microneedling session with PRF. Guys, this is just one treatment 1 week later. You'll notice there's great improvement in the skin tone, the complexion, the smoothness, and there's even some healing. If you've noticed, some of the blemishes have already started to heal as well. And this is a before and after of using the PRF as an injectable around the eyes. So the eyes are more open, they're brighter, the lines are greatly reduced, and so everything is just has a great youthful appearance to the eyes. And guys, this is just 1 day later with the PRF. So guys, like, weren't those results like awesome and amazing? Like, so that's what we want, right? And just also with that the PRF, those are results after one treatment. So one time going to get the injectables around the eyes with the PRF, and the other one is just after one treatment of the micro needling session with the PRF. So this is what I mean by those like faster results, by using the PRF as your conduit, or like what you're using to like inject into the skin or microchannel into the skin. So those are the amazing results, right guys? So highly recommend, of course, the PRF. Granted, you'll still have great benefits with the PRP, but like I said, those results are just a lot faster with the PRF. One thing I want to note, sometimes we get some questions about what will my skin look like when I do something like the micro needling. It's just going to be a little bit slightly, you're going to have like a little bit of pinkness, something like that, like, after maybe like a little slight sunburn is what it'll look like. But because of those healing properties in there, it goes away so fast. Just maybe about like 1 to 2 days, that pinkness and that redness is gone, especially if you're following the post-treatment protocol that your provider, your technician, gives you and recommends for you to follow. So no downtime, guys, really, to get those amazing results. Okay. So I hope you enjoyed this video. Please, like, if you have any questions about, like, is this treatment for you, you want to talk about it, you're interested in it, give us a call, go onto the website. You can book an appointment online. We can always, of course, consult ahead of time to go over, like, some concerns. What are your particular issues? What's the best package going to be for you? That kind of stuff. We're totally open to that. Know that we do still have the virtual consultation available, and of course we are open, so you can come in to schedule your appointment and come into the spa for your consultation, and also like start your treatment. So call us, book online, and just hope that you enjoy this video, the topic for today, and we will see you on the next one.